You know, a lot of back conditions, and even if it's not the same nerve that feeds these areas, but there's an area right here called your sacroiliac joints. So the sacroiliac joints are actually where the weight from the ground transfers up to the spine. So as we're standing here, there's equal distribution. There's weight pushing up through my legs from the ground, but that weight has to transfer through those sacroiliac joints into the spine and up for it to be dispersed. Same thing like when we're walking. Those joints take quite a bit of that force, and that's why they're very, very thick in ligaments. And some of our most powerful muscle groups cross those joints, like our gluteus muscles. But see, back problems can oftentimes shut down the muscles that are important for keeping that area feeling good and for keeping that area feeling stable. So that's where, if you have an actual back problem, that you know that some of those nerves are being affected, you know, that's where some of the problems at like L4 and 5, they can cause problems of weakness in some of the hip and leg muscles that actually help. Remember we were talking about the balancing on one leg? They help keep the shoulder over the hip, over the knee, foot, and ankle. They keep it steady. But say this hip is getting weak because my nerve is telling it like, hey, come on, we can't do that. We have a problem here, so take it easy. So that's kind of communication our body has with itself when we have a problem. So then that hip starts to get weak, my body starts to go this way. Well, my brain knows that that's not right. So then what my brain does is says, well, if you just lean over that way further, you know, you'll be fine. Well, this is the person that you see walking in the store like that. That can be a hip or a back problem, where there's a weakness in that muscle group. And oftentimes they usually have both because of so much time that they spent all this lateral shifting. So the side-to-side motion is kind of doing this to the discs and to the joints. And over time, those shear forces, it just kind of wears away, you know. In the center of this disc, you know, people describe discs as jelly donuts. That's a very inaccurate way to describe them because our disc is so much more than just a squishy jelly donut. It has a lot more hard substance to it than that, and that is why when a disc is herniated, it is so excruciatingly painful because these, do you see these fibers wrapped around the center of that disc or that nucleus? See the like spongy stuff in the center there? That's actually hard. It looks spongy in this picture, but it's actually hard. The nucleus is a hard like marble in the center of the disc, and then you have 90 layers of ligaments wrapped around that central nucleus. So these layers, you can see that some of the fibers are running oblique like this. We have some other fibers that are running oblique at a counter angle to that. Now, we've all heard that like bending, lifting, and twisting is bad for us. Why is twisting bad for us? Well, it's for that reason right there, where those ligaments, that they're like this. So as our body twists like that, this facet joint, the joint that helps to guide the motion of the spine, they kind of rest on top of each other. This joint is kind of locking against that one. This one's opening up and allowing all the pressure to come out this side, where this one is highly compressing, and those fibers, they start to twist around that disc, and they start to kind of tighten everything up in there. And so if you're having any weaknesses in the wall of your disc, which a lot of us do after a certain age, have disc bulges and little spots in our disc lining, or the annulus, which is the outer ring of, then that can just spill out. Does that make sense for the twisting? I find that it helps for people to understand like why it's bad, because I don't know, if someone just told me like don't do this. Okay, sure.